Shoulder arthroscopy, or a shoulder scope, is a common orthopedic procedure to address pathology in the shoulder. I'll kind of go over some of the specifics as far as that is concerned. This shoulder model, which is not a perfect shoulder model at all, will show us that there are plenty of structures that we can address with an arthroscope. Shoulder arthroscopy is done through small poke hole incisions, approximately 1/2 inch in size. Through those incisions, we introduce a camera into the joint. That camera will allow us to look at many different structures in the shoulder. Specifically, structures that we look at are the biceps tendon, cartilage surfaces, the rotator cuff, and then the labrum, which is kind of a gasket that goes around the socket. The most common shoulder arthroscopy procedures performed are rotator cuff repairs, which is essentially repairing the torn rotator cuff tissue back down to bone with use of suture anchors. Another common procedure is labral reconstruction or labral repair, and that is typically done for tears of the labrum or instability that results from like a shoulder dislocation. In a similar fashion to the rotator cuff repair, that is done by repairing the torn tissue back to bone with use of suture anchors. These typically are done as outpatient procedures. The patient goes home the same day. Typically, they are protected in a sling for several weeks after surgery, and then extensive physical therapy to get them back to doing everything that they want to do.